back on ttalk Boond Soch की train of thoughts powered by Dr. B and Brains Institute of Management and Ajmera. Today again we are having Dr. Sanket Mehta. We are having a series of episodes with him on various aspects of cancers like liver cancer, fibromental cancer, colorectal cancer, ovarian cancer, stomach cancer. We will discussion what we have on this show. Sir, welcome once again.
Thank you so much.
Now again, can you throw some light in terms of a minimally invasive surgery
Yeah. So, as the name suggests, minimally invasive surgery means surgery done by keyhole means. So instead of the traditional method where we take a big incision over the abdomen to access the organs inside the abdomen and remove the tumor, in minimally invasive surgery, we use small holes, either 5 millimeters or 1 centimeter in size, through which one of the ports, we insert a camera to visualize what we are operating, and long sleeve instruments to access the area and perform the surgery. We also have specially developed energy devices to make sure that there is no untoward bleeding or any damage to the surrounding organs. And using minimal access surgery, we are able to perform very complex surgeries by not opening the abdomen, and the only incision that is there, which is visible and which can potentially cause some minimal pain in the perioperative period, is the site from which we remove the tumor. So that is the advantage of minimal invasive surgery. Now, this can be performed either by laparoscopy, where a surgeon and his assistant stands by the side of the patient and are directly handling the instruments and the camera for performing the surgery, or by robotic surgery. Now, robot is a new advance in this field where it's not the robot that is performing the surgery. The robot is used as a tool by the surgeon to perform the surgery. The unique thing about the robotic systems is that the camera, which is normally held by the assistant in laparoscopic surgery, is also under the control of the surgeon, and 3 active arms are under the control of the surgeon. What this means is that there is a steady platform for vision and more than 2 instruments which we can control with our hands. The other advantage of robotic systems is the 3D vision. In laparoscopy, we have 2-dimensional vision and 2.5 to 3x magnification. In robotics, we have 10x magnification and a 3-dimensional vision, which is very realistic. The third advantage is wrist movement. So the robotic surgery is performed by the surgeon sitting on a console and using joysticks, very much like video games, to control the arms, and the arms inside the abdomen mimic the movements of the wrist of the surgeon. They have 6 degrees of freedom, because of which they can do every single movement that our human wrist and fingers can do, and which is why even in narrow spaces, especially in the pelvis or in the thoracic cavity, where laparoscopic instruments which are straight have a limitation because they can only move in 2 axes. This can not only rotate but mimic the wrist movement, so that it gives us more dexterity and accuracy in tackling organs in fine spaces. So that is the advantage of robotic surgery.
And how the surgeon decide that which is the best, robotic, laparoscopic, or an open surgery
Now, that is a very important question, and I'll tell you why. Because first of all, robotic surgery is not essential for all surgeries. While it is being marketed as such, it is particularly useful and known to give benefit only in surgeries where access is in a very confined cavity, as I just mentioned, like in the pelvis or in the thoracic cavity, or if there is a lot of suturing involved. For example, doing partial nephrectomy, as in removal of a part of the kidney for a tumor, where you have to suture it in a very small specified time period to prevent damage to the kidney.
Mm.
Now that involves very meticulous wrist movement,
Mm-hmm.
and which is why compared to laparoscopic surgery, robotic surgery can give an advantage. The problem is that a lot of surgeons are not used to performing laparoscopic surgery or not trained to perform laparoscopic surgery, primarily because there is a very long learning curve.
Mm-hmm.
Whereas robotic surgery is very intuitive, and which is why they can master the use of the robot within 10 to 20 cases.
Mm-hmm.
And which is why it is easy for a surgeon to switch from open surgery to robotic surgery as compared to switching from open surgery to laparoscopic surgery, which is why robot democratizes access to minimal invasive surgery, but it comes at a cost. That is the real thing. Robotic surgery will easily cost 1.5 to 2 lakh rupees more than a laparoscopic surgery. It is often not reimbursed by insurance companies, and therefore it's an out-of-pocket expense for the patient. And which is why, as surgical oncologists, it is important that we are proficient at both modalities so that the patient gets the best of both worlds.
Well, Doctor, thank you very much. I'm sure like many of the patients were scared as far as this surgery which is concerned. By listening to you, I'm sure like they get a ray of an hope, and also the understanding in terms of the different surgeries which are there, and it will be very easy for them to make a decision as far as their case is concerned. Thank you very much for being part of this show.
Thank you.
God bless you in abundance. Thanks.